Welcome to the Uncover Your Eyes podcast, a podcast where we uncover the truth in healthcare. If you are listening to this episode and haven't hit the subscribe or follow button, please do so. That helps us to bring you better episodes weekly. I'm your host, Dr. Meenal Agarwal, and today's episode is really long overdue. Have you ever walked out of your doctor's office feeling smaller or littler than when you went in? Feeling dismissed, like you don't matter? Feeling like your questions weren't answered? Feeling like you weren't smart enough to even speak up for yourself, or you wish that you had? I've lived this as a woman, as a mom, as a woman of color. I've experienced this countless times. We're talking about self-advocacy. Self-advocacy in the healthcare system. It's not about asking questions only, it's about being heard. I want to take you back to a time in my life that I've never really shared publicly. I went to see my doctor, and she was sitting across from me with a white coat, authoritative, confident. And before I could even talk through all my symptoms, she started writing a prescription for me. I felt helpless. I felt like I had to take this medication that she was jotting down on her paper. I never even got the opportunity to ask a lot of questions. And when I started trying to, I felt dismissed. I felt like I should just know what's happening is correct. When I left, I felt so belittled and so awful. I went home and Googled this medication. There were a lot of side effects of this medication. And there was a lot of studies on long-term usage of this medication affecting your brain. And I got nervous and scared. So I decided not to take the medication. Instead, I decided to seek holistic and other, means to help me with my pain. And I actually started doing a lot of research on my own and started navigating, my health and taking it in my own hands. But I truly felt like the healthcare system had failed me. Not only was I not being heard, but I also visited the ER where I was also not heard. Everyone just wanted to prescribe me with this one medication, and no one wanted to talk to me about why I was in this pain. I reflect on that moment and I think, how common is this? How common is it that we are feeling vulnerable? We are put in a state by our own healthcare system, our own healthcare providers, of being vulnerable. I was a mom. I was supposed to take care of my 3 kids. I was supposed to take care of myself. And if I didn't take care of myself, how could I take care of my 3 kids? But instead, I left that room. I left the ER feeling dismissed and more afraid than when I went in. Here's the thing that no one tells us. Doctors are strained. The healthcare system is strained. We get that. They're overwhelmed. There's more patients than doctors. We have 7 minutes to discuss our problems, if that even, and there are 20 other patients in the waiting room. Everybody is overwhelmed. The patients, the healthcare system, the doctors. And your doctor may actually care, but they don't know what to do. They're struggling as well. So what do we need to do about this as a patient? We need to self-advocate so that we don't fall through the cracks. A 2022 study from Harvard found that women wait an average of 33% longer than men for pain treatments in the ER. African American patients are 22% less likely to receive adequate pain treatment than Caucasian patients. Women are more likely to be told their symptoms are psychological. And up to 80% of women who experience symptoms of autoimmune conditions are misdiagnosed or dismissed. Let that sink in. We're not just being unheard, we're being under cared for. And that silence has consequences. What happens when we don't speak up? There's delayed diagnosis. There's poor treatment plans. There's increase in stress, anxiety, and mistrust in doctors or the healthcare system. And the worst part about it is we are delaying preventive care that can be life saving. And that is scary. Let me tell you the story of Ginny. Ginny is a 39-year-old mom of two who I met. She complained of extreme fatigue and shortness of breath. Her doctor said it was just stress anxiety, and she's probably just overwhelmed and needs to sleep more. She believed them for months. A year later, she was diagnosed with congenital heart failure that could have been managed early, but no one listened to her. And she didn't push because she didn't know she could. So, how do we navigate a healthcare system that wasn't built for us or wasn't even built for women or women of color? It's not about being rude or loud or cutting your doctor off. And we need to drop those stigmas. And also, healthcare providers need to drop that. Our patients who are self advocating are not being rude, loud. They actually have genuine questions. You are the expert of your own experience. It's about asking, can you explain that again? It's saying, I don't feel right and I want to explore this more. It's not apologizing for needing answers. Take notes. Bring someone with you. Don't minimize your pain or symptoms. And if your doctor can't handle that, it's time to find a new one. You're not a difficult patient. You're a determined one. As a mom of three, it hits differently. I'm not just advocating for myself, my own health, but I'm advocating for my children. I'm advocating for my parents. I am part of that sandwich generation that's struggling. And should the healthcare system really be what I'm stressed about? I need to set an example for my kids. I need to set an example for my daughter so she knows that she can speak up. And you don't have to shrink in the healthcare system or act like it's okay to be dismissed. You need to learn to speak up effectively. Let's talk about Nina. Nina recently told me her story. She's a mom of four. She felt off. She had brain fog, weight gain, and mood swings. Her doctor and family chalked it up to motherhood. You just had a baby. It's normal. She started to believe it. After years, her kids were both full-time in school, and she listened to her body and said, this is not normal. So Nina finally pushed. She asked for a full thyroid panel, and the doctor rolled his eyes, but she insisted. And guess what? She has Hashimoto's disease, an autoimmune thyroid condition. Nina pushed for the testing, pushed for the diagnosis, and she did her own research. She self-advocated, and she was able to catch it, hopefully at a time 10 years earlier than when her doctor would have caught it. Preventive care isn't just checkups. It's asking those hard questions before things start to spiral. Self-advocacy is preventive care. Self-advocacy can save your life. It's what catches things early. It's what challenges rushed diagnoses. It's what stops you from spiraling into months or even years of unmanaged symptoms. So if you're listening today to this and you've ever felt silenced by the healthcare system, you've left your doctor's office more confused than when you went in, let this be your reminder. You are not too much. You are not overreacting. And you are not just tired. You are the most important person in that room. Trust yourself. Take up space. Ask the question. Even if your voice shakes, be that patient because you could save your own life, your child's life, your parents' life, a family member's life. You could save a life by self-advocating. You do not need permission to protect your body. You don't need to shrink to be seen. Self-advocacy isn't optional. It's about survival now. And we are going to struggle through the healthcare system if we are not our own advocates. Advocate for your team. Your team is your family. Advocate for them. If this episode spoke to you, share your story with me and share this episode with a friend, a parent, a family member, and remind them that their voice matters. Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.Meenal Agarwal. Until next time, keep those eyes uncovered.